Hi, my name is Claire Harrelson. I'm here today with some of my fellow medical professionals to talk about a very important topic called National Opioid Crisis. I am a current bachelor's in nursing student at the Mississippi University for Women. So I'll quickly show you my audience and then I'll set the camera up for my presentation. And then one of my medical professionals is my camera person. Thank you. All right, let's see if we can set it up real quickly so I can start the presentation. Maybe if Perfect. A little more here. A little more. It's gonna be hard. Over on the other side. Oh. Better? Okay, all right. Thank you guys for being here. We're going to talk about a very important subject that's been in the news a lot lately, and that is the opioid crisis that we have going on in our nation. And the objectives that we'll have here today is by the end of the presentation, I hope you'll walk away with a better understanding of the national opioid crisis that we're dealing with here in the United States, and also we'll cover some of the statistics about the overdoses. Also by the end, I hope you will understand about the impact that it has had on our healthcare industry. Now for medical professionals such as yourself, I hope you'll also begin to understand some of the signs and symptoms of the opioid abuse. Now the last thing I hope that you walk away with is a knowledge of how that we can combat the threat to the health that opioids have caused. So here, opioid crisis in America is also known as an opioid epidemic. Actually, Donald Trump did consider calling it a national emergency. However, he did say that he would not declare a national emergency, but he did guarantee that he would put funds and time and effort into attacking what we're calling an opioid epidemic. So it's the increased use of non-prescription and prescription opioids here in the United States. And opioids are, of course, analgesic drugs that we use that is naturally derived from opium. And it's like heroin, morphine, opioids, and we use it as a acute pain relief. So in 2013, they found that nearly 1,150 people per day visited the emergency department. And this was all related to prescription opioids. Now here's a graph about national drug overdose deaths. You can see that dramatic increase starting from 2015 to 2017, and we just got this upwards pattern with all the narcotics going from around 10,000 to close to 40,000. So a huge increase. Now, opioid-related deaths, that's a big part of the problem, is that we're having overdoses. So in 2015, we had greater than 50,000 deaths in America related to drug overdoses. About 2/3, around 33,000, were all related to just simply opioids. So this is in comparison to about 16,000 deaths around 2010 and 4,000 all the way back in 99. So you can see the dramatic increase. Now, overdose and addiction victims in the U.S. are mostly white, working class. So it's not that thought about overdosing of drug addicts that we have those that are maybe lower socioeconomical, poor health, those that live in poor situations. We're finding that it is our white working class that is the mostly affected by the overdoses. Here's another graph, and it's America has the highest drug death rate in the world. And that was really surprising to me when I did my research. So you can see that the US of A has a total of 52,000 there, and that's an estimated drug-related deaths and mortality rate in 2015, and then followed down by the other countries. So we're really taking the lead in a very sad way. Impact on the healthcare industry, and this is where it would affect us as healthcare industry workers. The CDC has estimated that the total cost of the prescription opioid misuse alone in the U.S. has become $78.5 billion yearly. That is once a year. And that's including the cost on the health care, the loss of productivity from people with their jobs, and also the treatment that we provide. Emergency responders are also very heavily overloaded by having so many calls with the opioid overdoses, and it drains the 911 service. And instead of responding to typical things like heart attacks, strokes, other emergencies, they're spending time stabilizing overdose patients and getting them to the hospital. So So this resource has drained the emergency room in hospitals and how they treat patients, and eventually we're going to see even higher insurance costs to cover that impact. Now here's a national overdose death involving just opioids, and this goes across all genders. So you can see again the gradual increase with a sharp increase starting here in 2017. So signs and symptoms that we need to look for opioid abuse, and that's with us here not only in our local communities but here at the medical facilities. We want to see that if patients begin to mixing with different groups of people, changing friends, spending time alone, their loss of interest, they're not very hygienic anymore, they're not bathing, they're not brushing their teeth, becoming very tired or sad. And these are all things that we can educate families to look for their loved ones. Here in the medical facility, we're going to be looking for those that are frequently in the ER with back pain, other chronic pain issues, and asking for pain medicine by name. Of course, some of our opioid addicted patients are sleeping odd hours, they're becoming nervous, they're not keeping good attendance at work or school, and they also experience financial hardship. Now, common opioids, just so that we can all remind ourselves, are hydrocodone, oxycodone, oxymorphone, hydromorphone, morphine. We've even got the Demerols, the codeines, the methadones, the fentanyl. Now, fentanyl right here is one of the ones that we're starting to see a lot in the news. It's very potent. It's a very dangerous drug. And those who are used to taking hydrocodone in probably larger amounts and doing okay, they think they can do the same with fentanyl, and that's what's leading to a lot of overdoses. I know I turned on the news just this morning, and there were 2 more deaths of overdoses right here locally in my town. So that's very sad. So as medical professionals, what can we do about this opioid crisis? We can make some changes, but we have an estimated of 21 to 29% of patients on prescription opioids for chronic use, they misuse them. So we find that a lot of times, even though it has its purpose, opioids, it's made to treat pain, they are misused. So a lot of times they're have an use disorder, so they develop a addiction to it more so than just with any other drug. An estimated 4 to 6% misuse the prescription opioid and then transition to something called heroin, and that's the biggest problem with the overdose there. And 80% of the people who use heroin first misused opioids. Now the overdose increased from July 2016 to September 2017 in all 45 states, but 52 areas in those 45 states. So opioid overdose in large cities has increased by 50% in 16 states. So the national drug overdose death involving prescription opioids, you can see here the death rate continuing to rise. And how can you make a difference? Well, we can screen for those high-risk conditions. We can start evaluating differently as they come through our emergency departments. We can develop a pain management and find different pathways to work with them on their pain. Discuss other treatment options. A lot of times patients are truly not aware of other options to treat pain. Train nurses on opioid use and addiction and how to look for that. We can also educate families how to look for that opioid use and addiction and how to treat those drugs safely. And we can offer referrals to specialized clinics like our pain centers. So here are my references, and thank you so much for coming and listening to this very important topic that is plaguing our nation. And I hope you walk away with some learned information that you can take and put into use in your practice. Thank you.